Hi guys. So today I wanted to go through some of the blood work that I had. I wanted to let you know that it's very common for people with chronic fatigue to have just absolutely clean blood work. Just nothing shows up. Nothing at all. Red blood cells, white blood cells, everything looks perfect, even inflammation. A lot of times. Not always, of course, but a lot of times. And people with chronic fatigue oftentimes keep themselves very, very healthy because they have to. It's the only way to give themselves more energy, which makes their blood work even cleaner. So a lot of doctors will dismiss this because they only do certain blood tests. And I wanted to show you some of the blood tests that I did show up as being abnormal with, and most of them are rare. So I'm going to start off with, well, I'll start off with Lyme. Let's see. Now, my Lyme test, according to a lot of doctors, is clean. It doesn't show up as Lyme. But according to Igenex, it is Lyme. So, here's what we have. I only show up for one band, 41. And, for IgG, I show up as like 1 as well. And a lot of doctors would disagree and say that I don't have Lyme. So it's like hit or miss who you see and what kind of blood test they do. So this is an expanded Western blot. I only show IgM positive, for band 41. Okay, so that is Lyme. And they are treating me for Lyme, so it just depends on which doctor you see. Let's see, this is another thing my Lyme doctor found. Vascular Endothelial Growth Factor. I'm deficient in that. And I usually research all my own blood tests. I double check everything. I make sure that they know what they're doing and whatever. No idea what this is. No idea. A lot of patients with Lyme are deficient in this. I don't think they know what it is. Well, maybe they know what it is. It does like, I think something with your connective tissue. Don't quote me on that. But I haven't been able to find out what the hell this is. So I'm deficient in that. You'll see a lot of stuff like that on here. They'll be like, oh, this is so rare. We never test anyone for this. And you're deficient in it, in like everything that's rare. But if you just do regular blood tests, nothing will show up. So don't give up if all your tests show negative. Don't give up yet, because trust me, with my chronic fatigue, they could have just called it like multiple deficiency syndrome, because I'm deficient in so many random things. And so many doctors are surprised. They're like, oh, you're not deficient in this. They don't even believe you. And you're like, no, I'm deficient in all of these things. It's just that my blood work is fine. My CBCs are fine. All right, so they did a SPECT scan. Patients with Lyme sometimes have holes in their brain. The Lyme, well, it looks like holes on a SPECT scan. I never had that problem. I had lack of blood flow. Yeah, decrease of blood flow in the frontal lobes. So up here, which coincides with how I felt, because when I used to wake up, I used to just feel all this pressure here, and I couldn't think, and my memory was slipping badly. So it kind of makes sense that I would be missing blood flow here. And I wonder if part of that is because I had orthostatic intolerance so badly. Oh, that's what I should have showed you, the tilt table test. I think I have that. I think I have that here somewhere. Anyway, yeah, I think that perhaps my blood flow was so decreased from dropping to my feet that maybe I started slipping. And I think your brain compensates, and it the frontal lobes, I mean, let's face it, it's just personality, right? So I think they drop it from the frontal lobes first so they can keep all the blood flow to the important parts of your brain. So I guess that's what happened. But also vasopressin is I stopped producing that. Whew, I don't even know where that blood work is. Because I'm not organized right now. This is alright, let me show you the tilt table test. Oh, also weird stuff showed up in my heart. You don't need to see that. Yeah, so the vasopressin is produced in your hypothalamus, and that's in your brain, like behind the ears, well, like in the middle somewhere. And that stopped being produced, and the SPECT scan doesn't show really any of that, so I don't know. What the heck is this? I'm sorry, folks. I do not have my tilt table test. No siree, Bob. Failing so many levels right now. Well, alright. Showed positive for tilt table test. And, that's another thing it showed positive for. Vasopressin, also called arginine vasopressin. I'll show you a study, but it's not my test. Maybe at the end I'll show you pictures of the blood work so you guys can see. I'll research all this crap and I'll put the pictures at the end. This is how you spell vasopressin. This is a study I found. It is vasopressin is produced in the hypothalamus, and I showed that I was deficient in that until they gave me a lovely hormone that made me feel like $1 million. Loved it. Best hormone ever. If you guys are missing that, nothing like getting on that hormone. Okay, so at the end I'll also show you I'm deficient in amino acids and fatty acids, and I just wanted to emphasize how bad that is. You can't, those are the building blocks of your cells. You will feel like absolute shit until you get amino acids and fatty acids. So that's gonna be a deficiency in protein. So for a chronic fatigue diet, I recommend high protein, low sugar, because your body can't really handle the sugar without the protein. And if you're deficient in the protein, then that's gonna be a problem. A big problem. That's a big problem for me. I try to eat protein at every meal, and we're not just talking like eggs, because eggs don't always cut it for me. Sometimes I just need meat. So if you guys are vegan out there, I would be so cautious. So cautious. So cautious. Beans are good though. Beans help me a lot, so if you have to eat beans, then go for it. Eat beans every day. But definitely have your doctor test you for your amino acids and your fatty acids. You know what? Let me insert a picture of that right here. Okay, so those are my amino acids and my fatty acids. It shows that I'm deficient in them. So what I wanted you guys to realize is that probably none of this helps the doctors, but this helps you. What I did was I looked up every single fatty acid I was deficient in, and I purchase them on Amazon. So we're not just talking omega-3, 6, and 9. We're talking omega-7s, like random amino acids that I was deficient in that most people aren't. So they don't shove it in every supplement. You know, like fish oil you can find at any supermarket, but some of the fatty acids that I'm deficient in, they don't sell in a supermarket. Like, you have to order them online. So I'm taking omega-7s. I'm taking CLA, GLA, EPA, DHA, all of those bad boys. I'm taking them, and I'm telling you, lit my brain up like that. There's even another one I added. So if you guys have seen my memory supplement video, I added the omega-7s. This is a fantastic brand. It's also really expensive. I take 2 of these a day. And I just ordered the cheaper version of this. I forget the brand. I just ordered it. I'm not sure if it's going to work yet, because this is something called Provenol Purified Omega-7 Oil. Proviol, maybe? Whatever. The point is, you can personalize your own treatment if you go through your blood work. And in order to go through blood work that shows up all jacked up, you know, you really have to request it from your doctor, because it's very rare to be deficient in so many fatty acids. Very rare to be deficient in so many amino acids. But for chronic fatigue, for some reason, this is life for us. They don't know why, so I'm not about to attempt to figure that out today. But I wanted to show you this. Can you see that? So that's my 24-hour copper, 24-hour urine copper test. Range is 15 to 60, and 11. You know, I have the blood work to show it. Here we go. Just another example of perfectly clean blood work. Everything's perfectly clean. Calcium, this, that, liver, everything perfectly clean. And then you get to this, and copper. And this was when I was still taking supplements, taking 2 multivitamins a day, and I still showed up deficient, almost. Well, 69 and 70 is the minimum, so I still showed up deficient for copper. And so when I stopped taking the supplements to take the 24-hour test, and that's when I dropped down to the 11. So copper is a building block for your connective tissue. So if you guys out there are suffering with any EDS-like symptoms, Ehlers-Danlos syndrome, if you have any of those symptoms, but you know, not to the extreme, you just have like mild, like stretchy skin and all that fun stuff, definitely get your copper checked. And if you have Lyme, definitely get your copper checked. I have never been tested for copper, and I have stacks of blood work like this. I have never been tested for copper. This one hippie doctor tested me for copper, and he didn't even put me on it because he didn't know, you know, like, no one is deficient in copper, basically. It's so rare, and it's, I don't know. So I started taking it on my own, and I still haven't found another doctor to test me for it, because they don't even carry the tubes usually at the doctor's office, because like nobody is deficient in copper. So, but yeah, that's the thing. It's like hit or miss. You never know what you're deficient in until some doctor randomly tests you for it. And I just wanted to let you guys know, like, it took me 15 years. 14 years to be tested and to show up positive. All of this new blood work is from this past year. All these deficiencies showed up from this past year. So I don't even know if I would have showed up when I was 16, when I first got sick. Yeah, I don't know. I have no idea. I showed mild sleep deficiency, but it's not enough to warrant showing you guys the lack of results that I had. And yeah, So those are the things that I really tested positive for. Again, just to reiterate, it's copper, which is very prevalent with Lyme patients. Bartonella is an iron deficiency. Well, I mean, that's not what it is, but it causes an iron deficiency. Is it Bartonella or babesiosis? One of those. One of the other tick ones, babesiosis or Bartonella, is like blocks the iron in your blood. Lyme blocks the copper. From what I've read, and these are not studies, these are just doctors that have found Lyme patients to be deficient in copper. So, copper, amino acids, fatty acids, that weird thing, endothelial, vascular endothelial growth factor. You'll also see it called VEGF, by the way. Anyway, deficient in that bad boy. Also, if you go through your blood work, I did a whole segment on Epstein-Barr virus and chronic fatigue. So if you want to check that out, that's another thing that showed up positive for me, but not a regular doctor would just say that's a past infection. The doctor I'm working with now, Dr. Lerner, says that that's a current infection. Yeah, so just wanted you guys, whatever. Okay, I'm going to show you now a clip of the tilt table test, amino acids and fatty acids. I think that's everything. So copper, amino acids, fatty acids, and tilt table test are all the things that showed up positive for me. And if you want to dig further, it's Epstein-Barr virus, the expanded to show current activity. Dr. Lerner might be the only one that actually tests for that. I don't know. And Lyme, the Igenex test. I think it's also called expanded Western blot because it's the same bands, basically. They show you. It's just that they might, whoever tests you for the Western blot might say, oh, you don't meet CDC standards, but you still, you can still see the Igenex standards in there, and then base positivity on your own, whatever. Okay, so here we go. Tilt table test, amino acids, fatty acids. Okay, hope you guys have enjoyed this video. Hope it's useful, and if there's any tests that I missed, please leave it in the comments because I haven't been tested for everything, and sometimes you guys have been tested, and if it helps somebody else to get closer to figure out what's wrong with them personally and what's causing their chronic fatigue, by all means, send it, and thanks.